Metabolic syndrome diagnostic. If the patient is overweight or obese based on growth chart, the patient should be screened for metabolic syndrome. Patients can have apnea, lethargy, ischemia, checking blood pressure, blood sugar, cholesterol, triglyceride levels. Definition of constellation of medical conditions that commonly manifest together and significantly increase the risk of cardiovascular disease and type 2 diabetes mellitus. Criteria for metabolic syndrome 3/3 must be present. For example, patients is either diagnosed with or receiving treatment for a condition. Then elevated blood glucose, fasting glucose over 100 mg per deciliter, elevated blood pressure, systolic over 130 mmHg and or diastolic over 85, elevated triglycerides over 150 mg per deciliter, low HDL-C, men under 40, women under 50 mg per deciliter, abdominal obesity, men waist circumference over 102 cm, woman waist circumference over 88 cm. Metabolic syndrome is a cluster of condition that occurs together. Individual risk for heart disease, stroke, and type 2 diabetes. The criteria for diagnosis have been outlined by various organizations, with some variations, but generally include a combination of abdominal obesity, hyperglycemia, hypertension, high serum triglycerides, and low high-density lipoprotein HDL level. Characteristic symptoms and pathophysiology. Symptoms often asymptomatic, may notice on increased waist circumference, or symptoms related to individual components. Hypertension, pathophysiology central to metabolic syndrome is insulin resistance, where cells react to respond normally to insulin. This condition is closely associated with abnormal obesity and is known to be a major underlying factor in syndrome's pathophysiology, contributing to hypoglycemia, hypertension, dyslipidemia, and pro-inflammatory state. Clinical presentation and diagnosis. To diagnose metabolic syndrome, most guidelines require the presence of 3 or more of the following criteria: abdominal obesity, waist circumference over 102 cm per inch in men and 88 cm over 88 cm and 35 inch in women, with variation based on ethnicity, and hyperglycemia, fasting glucose over 100 mg per deciliter, 5.6 mmol per liter on or on drug treatment for elevated glucose. Hypertension, blood glucose over 130 over 85 mmHg, or antihypertensive drug treatment in a patient with a history of hypertension. High serum triglyceride over 150 mg per deciliter, 1.7 mmol per liter, or on drug treatment for elevated triglycerides. HDL cholesterol, HDL cholesterol under 40 mg per deciliter, 1.03 mmol per liter in men, or under 50 mg per deciliter, 1.29 mmol per liter in women, or on drug treatment for reduced HDL. Treatment. The primary goal is to reduce the risk of cardiovascular disease and type 2 diabetes. Treatment strategies include lifestyle modifications such as diet, exercise, weight loss, and smoking cessation. Pharmacotherapy may be necessary for managing individual components of the syndrome such as hypertension, hyperglycemia, and dyslipidemia. Prognosis. General outlook with appropriate lifestyle changes and treatment. Individual metabolic syndrome can significantly reduce the risk of cardiovascular disease and type 2 diabetes. Condition-specific prognosis varies depending on the degree of control over the syndrome components and presence of other comorbid conditions. Differential diagnosis table. Metabolic syndrome: 3 or more abdominal obesity, hyperglycemia, hypertension, high triglyceride, low HDL. Multifactorial risk factor for cardiovascular disease, type 2 diabetes, fasting glucose over 126 mg per deciliter, or HbA1c over 6.5%, and maybe component or separate condition. Polycystic ovary syndrome, PCOS, irregular periods, elevated androgens. Polycystic ovaries often associated with metabolic syndrome feature. High points diagnosis require at least 3 out of 5 specific criteria related to obesity: blood pressure, fasting glucose, triglycerides, and HDL cholesterol. Central obesity and insulin resistance are key features. Lifestyle modification is the cornerstone of treatment. Early intervention can prevent progression to more serious conditions like cardiovascular disease and type 2 diabetes. Understanding the diagnostic criteria and management principles for metabolic syndrome is crucial for healthcare professionals as it allows for early identification and intervention, significantly impacting long-term health outcomes. So let's sum up what I have read today. The metabolic syndrome diagnostic: if a patient overweight, obese, based on growth chart, shift between metabolic syndrome, anemia, lethargy, tachypnea, checking blood pressure, blood sugar, cholesterol, triglyceride level, oscillation of medical condition commonly manifest together as significantly increase the risk of cardiovascular disease and type 2 diabetes mellitus. Criteria for metabolic syndrome: over 3 must be present. The patient is either diagnosed with or receiving treatment for the condition. Elevated blood glucose, fasting glucose over 100 mg per deciliter, elevated blood pressure, systolic on 130, and diastolic over 85, and elevated triglyceride 150, and low HDL men under 40 and one below 50. Abdominal obesity, men waist circumference over 102 cm, woman waist circumference over 88 cm. Character symptoms and with symptoms: asymptomatic and hypertension, pathophysiology, and abdominal obesity, waist circumference, hyperglycemia, hypertension, high serum triglycerides, low HDL, cholesterol. Treatment: pharmacotherapy, diet, exercise, window, smoke cessation, general outlet condition specific. Metabolic syndrome: 3 or more abdominal obesity, hyperglycemia, hypertension, high triglycerides, low HDL, type 2 diabetes, fasting glucose over 126, or HbA1c over 6.5, polycystic ovary syndrome, irregular periods, elevated androgen holistic ovaries. 5-point diagnostic require at least 3 out of 5 specific criteria related to obesity: blood pressure, fasting glucose, triglyceride, HDL, cholesterol, central obesity, and insulin resistant lifestyle modification, all in